Hello all, hope you're doing well today. We are talking about chapter 21. It will be broken down into 4 parts. We are talking about clients with orthopedic injury or rehabilitation concerns. In this chapter, you should be able to recognize some common types of injury and orthopedic concern, as well as understand the impact of injury on physical function, and describe the goals of each phase of tissue healing, and describe the personal trainer's role in relation to specific orthopedic injury and rehabilitation concerns. Here we go. An orthopedic injury refers to any injury that affects the musculoskeletal system, which includes the bones, muscles, ligaments, tendons, and joints. These injuries can result from various causes, such as accidents, sports activities, repetitive motions, and degenerative conditions. Orthopedic injuries are typically diagnosed through physical examinations, imaging tests such as X-rays, MRI, or CT scans, and medical history evaluation. Treatment options vary depending on the severity and type of injury, but may include rest, immobilization with casts or splints, physical therapy, medication, or in severe cases, surgical intervention. Common types of orthopedic injuries include fractures. A fracture occurs when a bone breaks or cracks. It can be a complete break or a partial break. And there's more delineation that it can occur with that, but for our conversation today, we'll leave it at that. A sprain is something that happens when the ligaments, the connective tissue that joins the bones, are stretched or torn. It commonly affects the ankles, the wrists, or the knees. Strains, on the other hand, occur when muscles or tendons are overstretched or torn. They typically happen in the back, the neck, or hamstring muscles. A dislocation is something that occurs when a bone is forced out of its normal position at a joint. This can cause pain, swelling, and immobility until it's put back into position. Tendons are the fibrous tissues that connect muscles to bones. Injuries to tendons can include tendinitis, which is caused by inflammation, tendon tears, or ruptures. Cartilage injuries. Cartilage is the smooth tissue that cushions the joints. Injuries to the cartilage can lead to conditions like meniscus tears in the knee or joint, or damage to the articular cartilage in joints. Overuse injuries are due to repetitive motions or excessive stress on a particular body part, resulting in conditions like stress fractures, tendinitis, or bursitis. Macrotrauma and microtrauma are 2 terms used to describe different types of injuries based on the magnitude and nature of the trauma involved. Macrotrauma refers to a significant, acute, and often visible injury caused by a single traumatic event. It typically involves a sudden and forceful impact or excessive stress on the body. Examples of macrotrauma include fractures, dislocations, ligament tears such as anterior cruciate ligament tears in the knee, muscle strains, and severe contusions. These injuries are usually the result of accidents, falls, collisions, or high-impact sports activities. Microtrauma, also known as repetitive or chronic trauma, refers to small-scale injuries that occur over time due to repetitive stress or cumulative trauma to a particular area. Unlike macrotrauma, microtrauma does not result from a single noticeable event, but rather from repetitive or prolonged activities that gradually strain the tissues. Examples of microtrauma include tendinitis, which again is inflammation of a tendon, stress fractures, bursitis, which is an inflammation of a bursa sac, and muscle overuse injuries. Microtrauma commonly affects athletes or individuals engaged in activities that involve repetitive motions, such as runners, tennis players, or assembly line workers. While macrotrauma injuries are usually more severe and require immediate medical attention, microtrauma injuries can develop gradually and may initially present as mild discomfort or pain that worsens over time. Proper diagnosis and appropriate management of both macrotrauma and microtrauma injuries are crucial to facilitate recovery and prevent further complications. Injuries can have a significant impact on a person's physical function and overall ability to perform their daily activities. The specific effects of an injury on function depend on factors such as the type and severity of the injury, the body part affected, and the individual's overall health and fitness level. Here are some common ways in which injuries can affect function. Pain and discomfort. Injuries often result in pain, which range from mild to severe. Pain can limit movement, reduce strength and flexibility, and interfere with the ability to perform certain activities. A restricted range of motion. Injuries to joints, muscles, or connective tissues can lead to reduced range of motion. This limitation may make it challenging to perform certain movements or tasks that require full joint mobility. Muscle weakness and atrophy. When an injury affects a muscle or its surrounding structures, muscle weakness and atrophy or muscle wasting can occur. Weakness in the injured area can hinder overall strength and impair functional abilities. There's a loss of coordination and balance oftentimes. Injuries can disrupt the body's neuromuscular coordination, leading to impaired balance and coordination. This can affect activities that require precise movements or maintaining stability. And impaired mobility. Depending on the location and severity of the injury, mobility may be significantly affected. Injuries to the lower extremities, for example, can result in difficulties walking, running, or climbing stairs. There are functional limitations, so injuries can limit the ability to perform specific tasks or activities. For example, a hand or wrist injury may make it challenging to grasp objects or perform fine motor tasks. Similarly, injuries to the lower body may impact activities such as driving, participating in sports, or even performing basic self-care tasks. Injuries can have a psychological impact, leading to emotional distress, anxiety, depression, or loss of confidence in one's physical abilities. This can further affect functional recovery and engagement in activities. Rehabilitation, including physical therapy and occupational therapy, is often essential to restore function and help individuals regain their independence after an injury. These therapies focus on improving strength, flexibility, mobility, coordination, and functional abilities. The specific treatment approach depends on the type and extent of the injury and may include exercises, manual therapy, assistive devices, pain management strategies, and psychological support. Tissue healing is a complex and dynamic process that occurs in response to injury. The body's natural healing mechanisms work to repair and restore damaged tissues. The healing process typically involves 3 overlapping phases: inflammation, proliferation, and remodeling. Here's a general overview of tissue healing after an injury. The inflammation phase. This is immediately following an injury. The blood vessels in the injured area are going to constrict to minimize bleeding, and then vasodilation occurs, leading to increased blood flow. The inflammatory cells, such as white blood cells and platelets, migrate to the injury site. Inflammatory mediators, including the cytokines and growth factors, are released, which help regulate the healing process. The inflammatory phase typically lasts for a few days and is characterized by pain, swelling, redness, and heat in the affected area. The proliferation phase is where new tissue is generated to repair the injured area. Fibroblasts, which are specialized cells responsible for producing collagen, migrate to the injury site. Collagen forms a framework for tissue regeneration and provides strength and stability to the healing tissue. Blood vessels begin to grow into the injured area, a process called angiogenesis, to supply oxygen and nutrients necessary for healing. New granulation tissue is formed, which consists of collagen, blood vessels, and inflammatory cells. This tissue helps fill the wound and promotes healing. The proliferation phase can last from a few days to several weeks, depending on the severity of the injury. The remodeling phase involves the reorganization and strengthening of the newly formed tissue. Collagen fibers undergo reorientation and maturation to increase their strength and flexibility. Excessive collagen is removed and the tissue structure becomes more organized. The remodeling phase can last for several weeks to months or even longer, and the timing varies depending on the type and extent of the injury. The healed tissue gradually gains strength but may not reach the same level of strength as the original uninjured tissue. This is a great graphic for showing the healing phases with physiological outcomes. These physiological outcomes collectively contribute to the restoration of tissue integrity and functionality after an injury. It's important to note that the healing process can vary in duration and intensity depending on the severity and type of injury, as well as individual factors such as overall health, age, and nutritional status, and the presence of underlying medical conditions. Some injuries may require medical intervention such as sutures, surgical repair, or immobilization to facilitate proper healing. During the healing process, it's crucial to follow healthcare professionals' instructions regarding wound care, activity modifications, and rehabilitation exercises to promote optimal healing and minimize the risk of complications. This is another great graphic demonstrating the timeline for tissue healing. So in the first phase, the inflammatory phase, typically that's going to be something that lasts for a few days to 1 week. During this phase, the body is initiating the healing response by controlling bleeding, removing debris, and activating the immune cells to clear away damaged tissues and foreign substances. In the proliferation phase, this is something that's going to last generally for several weeks. And in this phase, the new tissue is generated to repair the injured area. The duration can vary depending on the extent of the injury and the type of tissue involved. Angiogenesis, fibroplasia, which is collagen production, epithelialization, and wound contraction occur during this phase. And then the remodeling phase. The duration lasts from a few weeks to several months or even longer. And during this phase, the newly formed tissue undergoes remodeling and maturation to increase its strength and flexibility. Collagen fibers reorganize, align in the direction of tension, and undergo cross-linking to improve tissue strength. Scar remodeling and vascular regression may continue during this phase. It's important to note that while this timeline provides a general overview, the actual healing time, again, varies depending on the individual and the circumstances of the injury. Factors such as their overall health, nutritional status, and presence of underlying medical conditions influence that healing process. Additionally, different tissues have varying healing capacities. For example, bone healing typically takes weeks to months, while healing of skin wounds may occur within weeks. More complex injuries or conditions may require longer healing times and may necessitate medical interventions or rehabilitation to facilitate the healing process. Again, it's always best to consult with their healthcare professional for accurate assessment of the expected healing timeline based on their specific injury and circumstances. But you can see on the diagram tendons, the healing time frame for those, typically 3 to 4 weeks and could be up to 3 to 6 months. With a muscle, the healing time is not quite as long depending upon the grade. And so if it is something that is grade 1, it can heal within 3 to 4 weeks at the longest. And then if it's grade 3, it would be 3 to 6 months. Ligaments, on the other hand, you can see they take quite a while. And then bone, of course, can take a little bit longer as well. During the inflammatory phase of tissue healing, the body initiates a series of events to control bleeding, remove debris, and begin the healing process. This is just an overview of the inflammatory phase. When an injury occurs, blood vessels in the injured area initially constrict to minimize bleeding. This is followed by vasodilation, where the blood vessels widen, allowing increased blood flow to the injured area. Vasodilation helps facilitate the delivery of immune cells, oxygen, and nutrients necessary for healing. Inflammatory mediators such as histamine and bradykinin cause the blood vessel walls to become more permeable. This increased permeability allows fluid, immune cells, and proteins to leave the bloodstream and enter the injured tissue. The fluid buildup contributes to swelling and the characteristic heat and redness observed in the inflamed area. Then you have white blood cells, especially neutrophils and macrophages, are essential components of the inflammatory response. The neutrophils are the first to arrive at the injury site, attracted by chemical signals released by damaged tissues and bacteria. They help combat infection and remove debris. Macrophages follow, and they have a broader range of functions, including phagocytosis, which is an engulfing and digesting cellular debris and pathogens and releasing growth factors to stimulate the healing process. Then there's a release of inflammatory mediators such as cytokines, prostaglandins, and growth factors that are released during the inflammatory phase. These chemicals help regulate the immune response, attract immune cells to the site of injury, promote that vasodilation, and initiate subsequent phases of healing. Nerve endings in the injured tissue become sensitized, leading to pain and tenderness. This pain serves as a protective mechanism, limiting movement and encouraging rest to prevent further damage to the injured area. The inflammatory phase typically lasts for a few days to 1 week, depending on the extent and nature of the injury. The inflammatory response sets the stage for the subsequent phases of tissue healing, including the proliferation phase and remodeling. It's important to note that the inflammatory response needs to be appropriately balanced, as excessive or prolonged inflammation can hinder the healing process. This is just a great graphic to demonstrate the inflammation phase, and you can see the capillary widens and causes constriction, as well as increased blood flow, an increase in capillary permeability, which also causes a release of fluid, and an attraction of white blood cells where that they migrate to the site of the injury. And then there is a systemic response associated with that, with fever to that particular area and the proliferation of more white blood cells. So all in all, that's going to increase in heat, redness, tenderness, swelling, and pain. Rest is a crucial component of the recovery process following an injury that allows the body to heal, reduces stress on the injured area, and promotes optimal tissue repair. Here are some key aspects of rest in the recovery process. Rest helps protect the injured area from further damage. It may involve immobilization through the use of splints, braces, slings, or crutches, depending on the type and location of the injury. Restricting movement and avoiding activities that could aggravate the injury allows the tissues to heal without additional stress. For injuries involving the lower extremities or weight-bearing joints, reducing or avoiding activities that place excessive stress on the injured area is essential. This may involve, again, using assistive devices like crutches or walkers to offload weight during walking, or engage in modifying exercises that minimize impact and strain on the injured tissues. Proper sleep and rest are essential for overall healing and recovery. During sleep, your body repairs damaged tissues and replenishes energy stores. Getting enough sleep and incorporating restful periods throughout the day allows the body to allocate resources to the healing process. Rest doesn't necessarily mean complete inactivity. In some cases, engaging in modified activities or gentle movements that do not stress the injured area can help maintain circulation, prevent stiffness, and promote healing. These activities should be guided by healthcare professionals or rehabilitation specialists to ensure they are safe and appropriate for the specific injury. As healing progresses, a gradual return to activity or exercise may be recommended. This process, known as rehabilitation or physical therapy, involves a structured and progressive program that gradually reintroduces movement and exercises to improve strength, flexibility, and function while minimizing the risk of re-injury. It's important to note that the duration and extent of rest required can vary depending on the type and severity of the injury. It's recommended to follow the guidance of healthcare professionals and specialists who can provide personalized recommendations based on the specific injury and individual needs of your client. They can help in determining the appropriate balance between rest and activity to optimize the recovery process. During the proliferation phase, several key processes occur to facilitate tissue repair. Angiogenesis, which new blood vessels are formed and grow into the injured area, supplying oxygen, nutrients, and immune cells necessary for healing. Fibroplasia, fibroblasts, which are specialized cells responsible for producing collagen, migrate to the wound site. They create a framework of collagen fibers that help rebuild the injured tissue. Collagen is a structural protein that provides strength and support to the healing tissue. Re-epithelialization. The epithelial cells migrate and proliferate to cover the wound surface, restoring the protective barrier of the skin or mucous membranes. And contraction. Myofibroblasts are specialized cells with properties of both fibroblasts and smooth muscle cells. Contribute to wound contraction. They pull the wound edges closer together, reducing the wound size and promoting closure. These processes collectively contribute to tissue repair and the formation of new tissue during the proliferation phase. It's important to note that tissue healing is a dynamic and overlapping process, and various cellular and molecular events occur simultaneously or in sequence to restore tissue integrity. Once the proliferation phase is complete, the remodeling phase follows. The remodeling phase is the final phase of tissue healing following the proliferation phase. During this phase, the newly formed tissue undergoes further maturation, reorganization, and remodeling to improve its strength, flexibility, and functionality. Here are some key aspects of the remodeling phase. Collagen remodeling. The collagen fibers, which were initially laid down in the proliferation phase, undergo changes in their organization and structure. They become more aligned along the lines of mechanical stress and tension in the tissue. This realignment helps increase the tissue strength and reinforces the forces applied to it. Cross-linking of collagen. The collagen fibers undergo cross-linking, where chemical bonds form between adjacent collagen molecules. This cross-linking process further strengthens the tissue and enhances its stability. Cell activity and extracellular matrix modification. Various cells, including the fibroblasts and specialized cells called myofibroblasts, continue to modify the extracellular matrix during the remodeling phase. They remove excess collagen and other components of the healing tissue that are no longer needed, contributing to tissue maturation and refinement. As the tissue healing progresses and the need for extensive blood supply decreases, excess blood vessels form during the proliferation phase, gradually regress and remodel. This regression helps optimize the vascular network to match the tissue's needs. The healing tissue continues to mature and a scar forms during the remodeling phase. The scar tissue is composed of collagen fibers, blood vessels, and other components, and it replaces the original tissue that was injured. While the scar tissue may not have the same properties as the original tissue, it gradually gains strength and stability over time. The remodeling phase can continue for an extended period, ranging from several weeks to months or even longer, depending on the severity and nature of the injury and the specific tissue involved. It is important to note that the remodeling process is ongoing even after the completion of the initial healing stages, and it may continue for an extended period to optimize the tissue's functional and structural properties. During the remodeling phase, it is crucial to engage in appropriate rehabilitation exercises and activities as guided by healthcare professionals or rehabilitation specialists. These activities aim to promote proper tissue remodeling, restore functional movement, and prevent complications such as stiffness or weakness. It's important to understand that the remodeling phase can vary in duration and intensity, and the specific outcomes and functional recovery can vary depending on the individual factors and the nature of the injury. The restoration of tissue refers to the process by which injured or damaged tissue is repaired and regenerated to regain its normal structure and function. Full restoration can be optimized through careful alignment of activities with the physiological phase of tissue healing. This is a great depiction of the integration of your rehabilitation goals across the healing time and looking at the different responses, the different phases accordingly. And you can see in the inflammatory phase, really the best thing to do is to rest, be able to control the pain and inflammation through your price protection and ice compression and elevation. In the repair and proliferation phase, you can begin some range of motion, flexibility, some balance and proprioceptive neuromuscular control activities, and some strengthening. In the remodeling phase, you want to really work on maintaining balance and proprioception and work on strengthening, functional strengthening, and returning to pre-injury activity. Indications, contraindications, and precautions are important considerations in healthcare and rehabilitation settings when determining the appropriateness of certain treatments, interventions, or activities. Here's an explanation of each term. Indications refer to the circumstances or conditions in which a particular treatment, intervention, or activity is recommended or appropriate. They are based on scientific evidence, clinical guidelines, and the specific needs of an individual. Indications help healthcare professionals determine when a particular approach is likely to be beneficial and should be pursued. Contraindications, on the other hand, are factors or conditions that make a specific treatment, intervention, or activity inappropriate or potentially harmful. They are situations in which the risks outweigh the potential benefits, and the approach should be avoided or modified. Contraindications are often based on medical considerations such as presence of certain medical conditions, allergies, or individual characteristics that increase the likelihood of adverse effects or complications. Precautions are factors or conditions that require careful consideration and additional monitoring when implementing a specific treatment, intervention, or activity. Precautions indicate that there may be potential risks or special considerations involved, and healthcare professionals need to exercise caution and tailor the approach to the individual's special circumstances. Precautions help ensure that the intervention is applied safely and effectively. It's important to note that indications, contraindications, and precautions can vary depending on the specific treatment, intervention, or activity, as well as the individual's health status and other factors. They are determined by healthcare professionals based on their clinical expertise and knowledge of the individual's condition. It's essential to consult with the healthcare professional or specialist who can provide personalized guidance and make informed decisions in the appropriateness of specific interventions or activities based on your client's individual unique circumstances.